Okay, this unit is about dealing with young children. How to deal with young children as a doctor or as a dentist. So this unit looks at the setting in which children are treated. In many cases, this may be the same as for adults, but there are settings such as children's wards that can be made more relaxing to put children at ease. For example, using bright colors and providing toys. There are often toys and picture books in clinics, GP surgeries for children to use. So the environment for treating children needs to be made different from that for treating adults. Why and how? This is a very important question, and you may be asked to write an argumentative essay about this topic. لأن طبعا إن patients who are less than 15 years of age make up of 20% of the average practices in the UK. فطبعا بالتالي هو they are very important. طيب. The unit also will cover some common childhood illnesses and talking to anxious patients. Okay, so actually it's clear now the environment for treating children needs to be made different from that for treating adults. So let's try to answer the exercise page 19. So what is the opposite of patient? Is impatient, confident, diffident, D-I-F-F-I-D-E-N-T, nervous, efficient, inefficient, I-N, inefficient, reliable, U-N, unreliable, sensitive, insensitive, I-N, honest, dishonest, respectful, disrespectful. Try to complete the sentences using an appropriate adjective, page 19. Dr. Mansour is very efficient. So we're going to use the adjective efficient. E-F-F-I-C-I-E-N-T. And everything she does. 2. Dr. Mubarak is a very impatient. I-M-P-A-T-I-E-N-T. Sort of person. He does things quickly. 3. Dr. Andrews is very respectful to all patients because he greets them properly and takes their wishes into account. 4. Dr. Chandos is not very honest with himself because he finds it difficult to admit his weakness. Again, number 4, Dr. Chandos is not very honest with himself. 5. My colleague can be very insensitive. She annoyed the patient when she referred to her husband that she wasn't married. 6. It's not easy to feel confident the first time you do something new. 7. Dr. Kamara sensed that the team thought she was unreliable because she let them down. Okay, here the answer of this exercise is very important. Okay. Okay, let's now move to page 80, and we're going to study together some of the dental terms, and they are very important for the midterm exam. So, number 1 is abutment. Abutment is the metal connector that your dental professional will place into your dental implant after you have healed from a surgery. Okay, it's like a connecting element. It's used in the context of fixed bridge and so on. Okay. Number 2, alveolar bone. It is the jaw bone that anchors the roots of the teeth. 3, a false tooth. A tooth that is lost from its bony socket due to trauma. Attrition is wearing away of tooth structure from normal causes. So here we have to pay attention from the differences between the coming definition and attrition. First of all, attrition, the tooth is lost because of normal causes like tooth chewing or mastication. Okay. As for abrasion, is wearing away of tooth structure but from abnormal causes. الابnormal causes زي ايه؟ bad habits or malocclusion. طبعا احنا اخدنا المالوكلوجن قبل كده وقلنا المالوكلوجن it's a problem in fitting between the upper and lower teeth when biting or chewing, like irregular bite, cross bite, overbite. كل دي indications of malocclusion. Okay. Erosion is wearing away of tooth structure from normal causes as a result of diseases or chemicals such as stomach acids and so on. Okay. Anesthesia is used to relieve the sensation of pain, usually given before surgical or dental procedure. اللي هو التخدير. Crown is the position of a tooth above the gum line. Okay, here we have number 9, edentulous. Edentulous is a condition in which all natural teeth are lost. Okay, we can call it toothlessness or edentulism. Okay, so it's a condition where teeth are missing in either the upper and lower arc. 10. Biopsy. It is the removal of tissue specimen from the pathological reason in order to perform histopathological diagnosis. Dentition is actually the natural teeth which are present in the upper and lower dental arc. Okay, bruxism is the grinding of teeth, especially during sleep or bad habits. Exfoliation is also called shedding. So these two terms are used interchangeably. It means falling off of the deciduous teeth. As for the last one for this lecture, exodontia is also called extraction. And as we have studied before in English 1, that we have here ex, which means out from, is a prefix. So it is a procedure performed by the dentist to remove or to extract the tooth. Okay. So as for the midterm exam, please study these terms. You're not going to be asked to write a definition, just going to have MCQ questions. You need to choose the correct answer. So don't study the definition, just study the term with its meaning, and try to also to study the other three units, unit which is about accident emergencies, unit about pain, and today's unit which is about parents and young children. Okay. Concerning the midterm exam, I'm going to speak with you about it in the next slide. As for the midterm exam, because of the shortage of time, you are going to ask to write just an introduction to an argumentative essay. You're not going to ask to write a full essay. This is only for the midterm. طيب احنا التوبكس اللي عندنا اتكلمنا عليها في الارجيومنتيف essay كانت ايه؟ كنا اخدنا topic اللي هو بيتكلم على emergencies and accidents, and you have already written an argumentative essay about it. Essay number 2 was about pain and how it's about mercy killing, to write about your opinion, whether you are for or against it. Today's topic is about whether children need special places to be treated. As a doctor, you need to prepare your clinic in a special way if you're going to deal with children. Do you agree with it or not? So if you're going to write just an introduction, you have to pay attention to your thesis statement. So writing your thesis statement is a key point for your marks. طبعا هيفضل لو انت to underline it، بس تعرف اللي انت في الثيسيس statement اللي هتبقى the last sentence في introduction or the last two sentences في introduction، لازم تبين لي فيها whether you are for this topic or this claim or you are against this topic or your claim. محدش يقولي I think في البداية خالص، لا، في البداية خالص هيكون طبعا هنراجع المحاضرات الأولى والتانية، هيكون just it's background information about your topic. Okay, and then while you are narrowing down to include other the body, you are going to write your thesis statement at the end of your introduction. طبعا بالنسبة للreading comprehension طبعا unseen. some of the questions طبعا احنا جربنا وشوفنا مع بعض في English 1 بقى تبقى stated directly وفي الانسرز بتاعتها في الباسج، وبعض الإجابات بتكون لا إجابتها محتاجة restate your point of view. وطبعا هيكون عندي vocabulary والامتحان مش هيبقى طويل قوي ف don't worry. الفوكابلي هذاكر ايه؟ هنذاكر الميديكال تيرمز اللي اخدناها قبل كده والدنتال تيرمز اللي اخدناها النهارده بلس طبعا الموجودين في اليونتس. اوكي. الامتحان هيدخل فيه في الفوكابلري اليونت عن الاكسيدنت والامرجنسيز واليونت about pain، لكن يونت النهارده اللي هي parents and young children مش معانا بس في الفوكابلري لكن معانا في الرايتنج topic. تمام. طيب if you have any question just contact me through the e-learning. Okay, and good luck.